pandemic has impacted the mental health of children and adolescents in a very adverse way. Within a few months into the pandemic, we began to see the prevalence of eating disorders in our clinic and in our inpatient ward doubling and tripling. The COVID-19 pandemic has resulted in a great disruption to the routine of children and adolescents, also social isolation. They're not able to go to school and see their friends. They're not the extracurricular activities. They're not the summer camps. And an eating disorder can be a reflection of underlying anxiety or depression. It can also be a means by which the adolescent is trying to gain control in some way. They can control what they eat or don't eat, and then they develop an eating disorder. Important signs of eating disorders is a preoccupation with foods, with eating or with not eating, restricting behaviors, skipping meals, refusing to eat certain types of foods. These are subtle signs. I think parents should be careful to, in a discreet way, to watch their child, to offer them meals and snacks. And if they see that they continue to refuse that or see that they're consuming caffeine instead of eating, these would be warning signs. If a parent is concerned that their child has an eating disorder, contact their pediatrician or their family medicine physician as a first step. For parents, for teachers, for society as a whole, it's important to keep a close eye on our children and adolescents right now. They're under a lot of stress. This is a very unusual time. This has been a stressful time for adults, but children are more vulnerable.